did we do it? A month ago?
It's almost just about 5 weeks.
Oh, 5 weeks. You've been asking literally for 5 weeks. You keep asking me how Scott looks. Okay, let me show you. Hold on, I want to show you something because I need this lighting is just crazy. You can see you actually have less wrinkles than I do. Look at these. Look at this. Right here. See this? Okay, you guys. Oh my God, Jason. Look, see this? This needs an eye pinch. Okay, now let me show you. No eye pinch needed because, wait, where is it? Because we bring the light a little closer. Bring it in. Because look, the wrinkles are gone, literally. Wait, hold on, I want to move you up.
Oh, okay.
There, okay, ready? Yeah. Look at that. Oh my God. Hold on, I'm gonna go like this. It's so wild. Look at my wrinkle right there. And then look at this, no wrinkles. I'll show you guys in a minute. It's crazy. He looks so good. His skin and everything.
Well, that's not me, right? It's your artistry, so.
It's artistry and skill mixed with just taking care of yourself. It's amazing. It looks so good. So everyone's been asking. So I'm gonna just do this because I want them to see that there's no filtering. Because someone accused us of filtering your pictures.
No.
They literally have accused us of the filtering. So we're gonna do a little touch up with filler, and I'll show you guys now. Here we go. Wow, it's crazy. You know what I wish I had my iPad, but I don't, but I'll do it later. It's amazing. You guys can see the scarring here and a little bit around the ear, but that's nothing. This will all heal. Oh my God, that keeps falling. We're gonna laser all this today. He's gonna do a second laser and he looks amazing. What we did do, which I know a lot of people were questioning actually, was the lip lift. So I want you guys to see the lip lift. Look right there, hold on. I think is one of the best treatments someone can do. And I like because yours is very natural. Because were you nervous about it or no? You're really nervous because you trust me.
Until you said I needed it.
No.
And I saw my befores.
Yeah.
And huge difference.
I know. People don't realize it because what happens is this distance right here to here. So this is called a columella right there. This filtral column falls as you get older, and then the lip turns downward. And then you had no lip, and you can't really fill no lip. But
and
this
you couldn't see my upper teeth.
No,
right? So.
not at all. And you see, look here, it's very natural, and there's a little filler. So you guys, it's not bad for having a procedure people are nervous about. The other thing I wanted people to see was the eye. So I want you guys to look here, the eye. You can't see any scars. I mean, it's quite amazing. The other thing is the balance of the filler. What else do we do besides structuronics, I call it, where it's on bone, right? So these areas on bone, we use fat grafting. And you said I couldn't get any fat because you didn't have any.
I didn't think you could.
And he didn't even know where I got it from after doing the procedure in his inner thigh. He had no clue. But the good thing is it looks very youthful. Like, don't you think there's more of a glow to your skin?
Oh my gosh, yeah. It's so much better.
I know.
It's smoother, it's just fuller, it looks much more chiseled, defined.
So there were a bunch of questions that they asked me. Are you okay?
No, we're just taking care of a few other things.
Okay. There was a bunch of questions that our videographer, Gerald, who videotaped you, wanted to know.
Okay.
And he wanted Lindsay to hold the camera. And I'm going to ask the questions. So I'm going to do it real quick so that we can do the structuronics. So here's the thing. So you go to meet him, but I want him in the frame. So they wanted to know, what was the treatment you had? We call it the MAXORIS orbital ascent, and I'll explain it in a minute. But what was the treatment you had, and why did you want to do it?
The facelift?
Yeah.
Okay.
So you just call it the facelift.
You have the technical terms, and I just have.
I have the branding terms, okay? Because
layman's terms.
we take people who are dedicated and devoted to making change and transformation. That was him because his face fell after working out so much and taking care of himself. It's not really necessarily just age, although with age you need it, because I now want a facelift because of the results. But at over 60, I'm not going to tell you his age. Over 60 though, he looks amazing. You're going to have loose skin, but you work out a lot. So why did you want to do it?
Well, not only was it loose, but it was sunk. I had sunken skin.
Yeah.
I didn't realize how long the upper lip was.
Yeah, that was a big difference.
Thing, which I think in retrospect,
you were
I was hiding my face a little bit.
No, I know what it was. He was being a rebel. He was trying to be a rebel at his age because he wasn't a rebel when he was younger.
No,
I'm kidding.
That's true. You're right.
But I think that's true. People do block their face when they're less confident. You know who I knew where I always had my acne scars. My acne scar patients always come with hair that's long, covering their face. Their heads are down with hats.
Yeah, yeah.
And actually Jason's a good example. He had a lot less chiseling. He had a lot less chiseling and stuff on his face, and you had a totally different design to your face. And then after you started looking good, what did you do? You like
Cut my hair off.
yeah, he cut his hair, he did it, and we've had a lot of it. It's a good example. So it's the self-confidence. So you did the when you were gonna do the procedure, what did you think you were having done?
Well, I thought it was having the facelift, so it's pulled back.
Right.
And I was hoping that you'd fill it in. And this was really sunken in here. It was sunken in here.
I mean, you had heavy folds.
Yes, I did.
You had heavy
And it
folds
was
on low volume. So with that, you can't just put filler and overdo it. So we created structure, and then we used what I call pain facial volumization. We used his own fat and some other stimulants that stimulate collagen and fat to grow. So you can see a natural look. That's why, like, when I saw you today, you're more radiant than like a month ago. That's because right now, why? You have the stem cells, the collagen producers like a Sculptra, Renuva, they're there, and we did PDRN. What's PDRN? Lindsay, what's PDRN?
PDRN is your salmon enzyme.
Yeah, so it's salmon DNA.
okay. I didn't realize that.
So you didn't know it was there, but it's in what we call our BioRain hybrid. So we took PRP, we take stem cells, we take PDRN, which is there's different versions of the DNA.
Exosomes.
It's making everything brighten up.
I mean, he did the gamut. You did. Honestly, you did everything possible that you could do.
Right. That's why we get the best. So
exactly.
then
The best,
so
you get the
he
best.
wanted to know, there were a couple other questions like, why did you choose to go to us? You can, but answer,
I mean,
because what if someone
honestly-
doesn't know me?
Okay. So
He's like, don't make me answer again.
I don't know how to start. He did because I saw on Instagram. I saw all the results from before. You did the body, right? Body lift, the abs.
He did his body before. He was
Yeah.
what I call the theraform transformation.
Right.
Inner and outer wellness. He did taking care of his hormones, taking care of peptides, just
Peptides.
eating right, working out, did his body, felt better, now doing his face.
Yeah.
But
Let's
what I'm
start from
saying
the
is
bottom,
like more
work our
like
way up.
why is, what about our practice? What about me makes you want to
my
go
God.
to me?
Sorry.
That's-
You're Blue Nova.
Okay. Because not only are you the best, but I just feel like you make a friend for life. Honestly,
It's true.
there's nobody. You know, if I try to contact him, he gets right back to me.
If he sends me a DM and he's not working out, I'm like, why are you not working out?
Yeah.
So I put him in place.
He does.
No,
So
I think that's
he's my
great.
sounding board. He's just, and I tell him how happy I am, and just I love
great.
coming here to see you, and
That's
you do the
great.
best work. So
So what other questions do you think people would want to know if they were going to have this procedure?
Oh my gosh.
Is there anything you
It's a
didn't know?
process. No, I mean the first couple of days I was saying, I had pain in the jaw. That went away.
Did you have a lot of pain from the lift?
Not the lift itself,
Because
no.
people think the
No,
lifts
the
are
lift
very
wasn't painful at all. No, I didn't feel any pain.
I think lasers are actually worse, to be honest, because you get the heat makes you swell more. You look like a pumpkin sometimes the first day, and you have to put a lot of creams on. But they're critical. Otherwise, you can't do that strong. And I'll show you guys later some of the before and afters because I'm sure Lindsay took great pictures.
I sure did.
Okay, because I'm gonna take that before and after to show you the sun damage. Like, look at the radiance. There's a little redness
Oh.
still, but not much.
Yeah.
I mean, if we go in like super close, look at the quality of his skin for his age. There's almost no wrinkles. There's just a little wrinkle there, big deal, and almost no heavy folds anymore. The fold is normal. That's all normal. So now we're just gonna do little touch-ups
Yes.
of areas to make him look better. So
And the other thing that I do, like religiously, is the creams,
you do.
the whole protocol.
Oh, yeah.
every day,
And
line them up, peptides, to do them. You name it. If he tells me to do it, I do it.
See?
Yeah.
That
And
is
here
good.
we are.
I trust him with my life. I say it all the time. Love you guys, everybody here.
I don't know what
Best.
else. Gerald, I think I answered all the questions
Yes,
best I
Gerald.
could. I'm trying to think. I'll look on my email if there's any others, some later. But I think the key for nowadays is there's AI, there's filters. It's very difficult to know good results. You can only know, and the relationship is if you watch videos. And you gotta watch, although that's not necessarily true anymore because of Midjourney.
Yeah.
Midjourney and Sora. But you can really look at the videos and see what the people say and the relationship that they have, because it makes a big difference.
Yeah.
You don't want to go to somebody that could be filtering.
And I do have one more thing to add.
Okay.
If I ever send pictures to you guys, from home, I will never filter them because I want it to be the real thing.
You should.
Oh, yeah.
I don't
That's
want
key.
anybody, thinking that I'm lying or, making things up. So.
And I also tell people, if you're gonna send pictures in for a consult, don't wear makeup, please.
Oh my
We need to
gosh.
see you at your worst, so we can make you look your best. That's what I always tell people. All right, so let's
Yes.
we're just gonna do a little balancing, because this was our next phase. Most of what we're gonna do today was a little bit of structuronics and a little bit of the Renuva PDRN in these regions, like just for lifting here, because this could be still some swelling, it could be a little bit of the fat that could go down. We should this light up a little bit. So I was just gonna do some balancing. So we're gonna use
There you
that's
go.
perfect. So we're gonna use some radius and temple. Hold here, perfect. I'm gonna do a little bit on the jaw. And that's the cheek area and stuff, just more because there's a little bit of swelling. Then we're gonna do lasering. Okay, lasering to calm down redness and just get any more residual sun damage, because usually what I like to do is at about a month to 2 weeks, a month to 6 weeks later, laser the scars and also stimulate the collagen production from the laser we did in surgery. So we complement that procedure with another procedure. Now everyone goes, oh, it's a lot. The thing is that you'll look your best. It's your choice, you don't have to. And you could literally just do your scars, but you will see his results would be amazing.
And what's the timeline that you think that kind of takes to?
Well, once you
Okay.
that'll be like a month or two after surgery, and then honestly, you can do this quarterly.
Okay.
If I tell people like a couple times, 2-3 times a year. I mean, look, if you wanted to come every 2 months and do a lighter thing and then a stronger thing and alternate, we could totally do that. It's just if you're doing the skincare, you don't necessarily need to do that as much. So.
I was telling him earlier when we were numbing and just
Okay.
chit-chatting.
You watch
I was saying how snatched he was. And
face or body?
No, this.
I know.
I've never seen his body in person, so we'll have to do a reveal later. But all here, like this is so snatched, like his jaw. I was like, me next.
I know. Lindsay's been waiting
Oh, I know.
because she lost so much weight, so she's been
Yes.
waiting. She did get a little filler, and she's getting kiss. She's getting Restylane kiss her lips
Oh,
for
yeah.
I was gonna
Valentine's
say just in time.
Day. For
Oh, yeah.
Valentine's Day. So son, I'll show you. So this will give a lot of support. What does all your friends and family say?
So my family hasn't all seen me yet.
Wow.
No.
Oh, you're
I
really
did-
waiting to
I
reveal.
did tell them, but I haven't seen
Whoa.
everybody yet, so they will.
Not yet.
My wife, of course, has seen me.
Yeah.
Oh yeah. Oh wait, so they don't see my Instagram? Oh my god.
I know.
I know that's amazing.
I haven't.
They don't have to. It's okay. I'm a little upset though.
No,
I'm
I'm
kidding,
sorry.
kidding. I'm kidding. No, I think that's amazing. I think it's amazing. But I mean, the thing is, because the difference. So here's what's funny. If you put your before and after together, it's like, wow, that's a big difference. Like you look different. And some people could say a negative comment. They could say, oh, it looks great, but he does look different. Not done, different.
But I'm
Because-
fine with that.
I know, so this is what I was gonna say, but if you look at yourself and you don't look at the before, nothing looks done, right?
Okay, yeah, I see what you're saying.
You see what I mean? Because if you put it together, people will be like, oh, I didn't wanna look different. But I don't think different is the issue.
And I kind of did.
Well, you needed to. You
Yeah.
needed to.
Well,
I
discussion
don't mean
before
that in a
was.
bad way, it's just, you had a lot of things going on with the face because of aging and working out and stuff like that. It's not your,
Yeah.
So I think this is great. So what we're doing right now is what I call structuronics, because structuronics means you restructuring the face and keeping it in that structure because of changes that occur over time. So for example, with aging, your bone changes. The good thing about this is these fillers that we're using are not just hyaluronic acid to fill a space. These are actually building collagen and bone. So that's what it's doing, so that he won't have his lips drooping anymore, or the chin recessing, because we built back the chin that's fallen, you know, because that happens over time. You couldn't see his teeth. And I'm really happy though that you decided, can you give me more of these? The gray ones, I think they're there. I'm really glad that you decided to do the big combination. And that's the thing, is I did a great consult the other day. It's really cute, I would say beautiful woman from Utah. And I could just tell she had very similar as you, structured face, but a lot of lost volume, heavy nasolabial folds. And what did you tell her to do, Lindsay?
I told her to do a lift. Like, she would look phenomenal
And you know
if
what?
we
She
just
was
tightened it up.
excited about it. She's like, you know what, you're right. She goes, I just don't want to look different. And I said, if you put the pictures side by side, it's gonna be a big difference. But if you get the treatment and no one's seen you in a while, they're just gonna be really young.
Yeah.
And that's key. That's really the key. You don't want to look done.
Like, she was the perfect candidate to get something done, a facelift.
Oh yeah. And that's the thing, Scott trusts me, so I was like, do the lift. And we made it happen.
Yeah, you said it would change my life, and I feel like it has already.
Oh my god.
Say that again. What'd you say? It changed your what?
Life.
Changed his life.
It changed his life, guys.
It really
It
does.
does.
I'm not making that up.
Well, Lindsay,
Oh, I know it's true.
Yeah.
no, it is.
Things
It's
I've done
great.
have changed my life. Some of my
I know.
surgeries.
I agree. Because like Lindsay had gastric sleeve and lost a lot of weight. And I'm telling you, I mean, yeah, she has a little loose skin right now, but the contour and the youthfulness is very apparent,
Oh yeah.
you know?
We're on our way. We're becoming final boss.
Oh, yes. Lindsay's gonna get her Celesta orbital ascent.
We're doing that, and then we're
I
gonna
can't
do
wait to
some.
see that. When are you gonna do that?
Oh,
She wants
we're
to
gonna.
do it. She'll do it tomorrow.
I would literally do it tomorrow. Oh, I'm gonna trade you. And then we get our A-frame and Glutenova.
I agree. But you know, we've had that same thing with Carmine. Carmine, a client of ours who did Instagram, he had a bad facelift that went wrong in Jersey.
Get under there.
And he wouldn't show his face forever because of it.
Oh yeah.
And then he, you know what, I said to him, just redo it. Why would you be depressed? Just redo it, you know? And you know what, I couldn't believe it, he did it. Came to LA and did it, and he did social media.
I know that's
And I've never
that's
seen
actually
someone
crazy.
so happy, he told me that he couldn't believe that both guys and girls were hitting on him.
Oh, I remember him. Yeah.
You remember him?
Yes, I do.
He was so funny. He goes, I've never had it my whole life, both guys and girls hit on me.
That's so funny.
I said, what the hell, I don't get that. That's crazy. Okay, so now so I did my structured. Now I'm gonna do some blending in the tissue in the under eye. So what's my favorite combo, Lindsay, for under eye?
Under eye, we like to do some Renuva with PDRN.
But, you know,
We
I'll
like
tell
to
you,
feather it in so it's blending into this area here. It's blending and we're not creating a shelf. So it's gonna blend in this area, it's gonna regenerate your fat cells, and then it's got the salmon DNA for collagen production.
Collagen, brightening, anti-aging. So
Oh,
what
yeah.
I'm gonna do a special way, because I did some fat graft and turned left a little bit through this region and down in the submalar area, because he had a heavy loss of fat in that area. We're gonna go down to bone. It feels weird. Okay, I'm on bone pushing right here, you guys. I'm using the PDR and Renuva to build what's called a puriform aperture, which is down here. That holds that area up, keeps the folds looking natural and more lifted. And then I'm gonna go up into the fat pads under the eye here and give them support. So it's gonna feel a little weird. And I know he already has some fullness here, you guys, but again, fat may not survive always fully up to 3 months or only a month in. If he loses this, he'll be unhappy. And so I do this little enhancement. This is not really volume. This is to keep the volume, because this is Renuvo, which is a synthetic cadaveric fat, or what we call an ECM product. It's an extracellular matrix and proteins that helps the fat that you've injected survive and your body to produce more. So you're basically getting a natural outcome. Now, why is it a little hard for me? Because he's literally so tight from the facelift. And so it's okay, I'm not gonna hurt the facelift, we just have to go a little slower and make it even. Also, the other area I want is this submalar area. This is the buccal area where people tend to not do fillers because they want this area to look a little more chiseled, but I don't want them to go back to having no volume. It won't look as good.
Oh, yeah.
So that little bit along the submalar plane, which you, okay?
No, I'm good.
No, it was good.
Thank you.
Okay, just making sure, because it looks like it hurt, but it doesn't, I know. This is gonna give him good support. It's also harder, because he's a guy, because he has hair follicles, to get the cannula through. So, much safer to use a cannula, obviously, but now this will just give support here and help give the fat grafting to survive. Okay, so switch sides with me.
Thank you.
You're welcome.
You give me a little support, so that's good.
I know. Well, it's been proven that when you distract
It
with
does.
something different,
You gotta do it typically
From
the
any-
opposite side. So Lindsay
perfect,
did
that's what
that.
I was doing.
Yeah, she did
Yeah,
that.
it does work.
Yeah, I've given full calf and feet massages while people are getting lasers and different things.
Yes.
Yeah, we'll rub your hands and all kinds of stuff.
Alright, so now I'm gonna go here. Same thing. And then again, these are more hybrid regenerative structuronics in tissue. And I like, from years ago, always used to do a low G prime hyaluronic acid to this area and this area. What does that mean? Soft filler that you can't really tell is there, but that doesn't build.
I don't know. I don't know.
It doesn't build collagen. So, let's go in here. So this is a way that we will build his own fat in collagen and be anti-aging without overfilling, without it looking overdone. So we'll get a little more full today because there's a fluid. We're doing laser anyways. And then I'll go over here because this area is tight. There, perfect. Do a little more here in that submalar space. Beautiful. Just because I want the under eye. Now, you guys can see, now his eyes are closed. Take a look at the scar. Just so you guys get an idea of how good this is. Look at that, look at this perfection right there. Open a little bit, I want to see. See under here? Look at this. Right here. Orbital ascent, you guys.
I literally can't even see
Absolutely
underneath.
perfect. Hold it there.
Not at all.
No, it's amazing, right?
Yeah.
Would you rather my eyes be open? Would that be better, or?
No, it doesn't
Okay.
hurt. I was just wanting them to see the scarring,
Yeah.
that you can't see. I literally want them to see scars they can't see.
That one.
Yeah, okay, there you go.
Alright, lastly, I'm gonna do a little enhancement of lip and corners of the mouth. And honestly, everything else is perfect. He has a great nose, nasolabial folds are good, cheeks balanced. Sometimes even adding like one little dab of a hyaluronic to the corner of the eye, this area is good. Because this area we tend to lose a little bit of volume. I did a little bit of, slightly. I did a little bit of, you know what it is, Lindsay? I just thought of the laundry.
Oh, okay.
I did,
Yes,
I
it
did
is.
a little Renuva there.
We were talking earlier about the lips and how everybody looks a little good with a little lip.
We do the upper part, right? Do you also do this side?
I do, but you have to be careful for you, because so he asked a good question, guys, I'm gonna show you something. So, the lip itself is divided into 5 Well, okay. Some people would say 2 on the bottom and 2 on the top, 4 units. However, the real description of a lip, in my opinion, is if you look straight, there's pink lip up to what's called the vermilion Cupid's bow, which is this middle section. So if you separate out the middle section and the 2 laterals, then it's 5 sections to 6, but 5 on average. So I treat the lip as 5 sections, lateral sections, 2 middle sections, and then the 2 bottom sections.
Okay.
The issue with that is if you treat it not like that, you then create a tube effect. If you don't have the middle part in the M or W shape. So for example, oh no.
Oh no,
Yeah,
that's
get it.
okay, we got the other one, it's right there.
Girl, get it. Hurry.
I'm trying.
It's
We
okay.
all work with it, right?
Yeah.
Yeah.
So what I would do is, so I treat your lip, if you do too much laterally, because you naturally have the lip lower and you don't have a lot of show when you smile, it'll look folded over.
Okay.
So
You hold
what-
that.
With
You
your
look at
lip,
your lip.
Or-
fuller on
it's,
that.
it's because I have
Actually-
a little bit bigger, like your lip naturally is smaller.
I don't even know.
It's more compact.
Oh, are they
Okay.
underneath?
So you
I have
don't
no
want
idea.
to create a wider lip than somebody that already has. Because like when you smile, for example, and this is a great example, we can pull this over and turn this up. Hold on. There. If you look at his lip, hold on. Here. If you look at his lip, and when you smile, this outer third right here, you lose the teeth. So you don't want to put too much there because it's just gonna fold over it. Yeah.
There we go.
Yeah.
I'm just
So,
curious. Okay.
but the thing is, you could do a little, you could do a small amount. I think for you, it's more of, elevation. That's the key. You really want this, because you know, we just did the lift,
Will you get a squeezy ball?
and then there's
I
no,
see
literally
your
no,
hand.
there's literally no corners of the mouth. They're literally turned up, or they're horizontal. So
But I'm
it's
good with
perfect.
whatever you decide.
Yeah, I wanted to look exactly natural. I don't want
Yeah.
someone to know you had it, you know?
I know, I see your hands, Clinton.
So-
When he does my filler, I always make him do my lips first. Well, I request, I don't make anybody do anything, especially not a
I
doctor.
can go brighter, can it?
It can, I think. Because my lips are sensitive. There we go.
Mm-hmm.
I think it's just holding it in like,
Yeah, a teeny bit.
yeah, looking good.
Great. Great.
Yes, well,
So that's that. Now, what I wanted to,
you look so good. You already looked good.
so what I was
And
gonna
we're
do-
just continuing.
So you guys take a look. I mean, it's just balancing. So a little bit more structure here. This is our regenerative treatment for him today, and then on the sides,
Oh, yeah.
it's just the lip, just balancing the lip. I'll
Your
show
lips look
you.
so good.
Oh my gosh, you know what I do? I never had a lip, so I'm happy.
Oh God, having a lip versus not having a lip, you have it.
Yeah.
They want silver mirror? No.
I don't
Grab
know,
it next
sorry.
to it. I'll wipe them.
Like the cameras.
You can keep it open, no one's here. Alright, I'm gonna do pixel really quick.
Do you want to
Because
do
he's
the other one
numb.
real quick?
Which
I don't know
one?
if he's quite numb. I think I
Well,
need to renumb
I think
him
I
just a
should
little
do.
bit. A
You think
pixel,
so?
yeah, pixel.
I think it'll be fine. I was
Alright.
gonna do pixel, I could do pixel halo
Great.
really quick, and then he could heal. And then he
Whatever
could-
you want.
he-
I'm
why-
gonna end this on this note.
Hold on,
This,
I'm gonna
oh,
see
never
himself.
mind.
Okay.
Okay.
We can do it. Okay.
What do you think?
Oh my God.
It's, I mean, it's nothing crazy.
No, but
It's
I
just
can see
balancing it. A little bit
Yeah.
more structure there, a little
Yeah.
more just to balance.
Yeah.
Yeah.
Volume, which is full, balanced, you know.
That looks
Now we treat
incredible.
scars.
Yeah. Wow.
How do you feel about where you came from before? Because now you were like
You mean
structured.
From the beginning?
No,
Or
your
just from
face,
today?
just the face lift. Like, what did you feel you looked like before compared to now?
Well, I didn't think I looked as bad as I did, but then I looked.
No, like, because I didn't think you looked bad either.
But then no,
But, like,
once
what
I
you
shaved
had.
off my beard and everything like that,
Yeah.
and I could see my skin and the before pictures,
Yeah.
I
Because like right
I
now,
felt disgusted with myself. I'm like, I can't believe I.
your face is like so like tight and structured now.
Oh, it's huge.
Like it's unbelievable. Like if you look up a little bit, you guys look at this. The tightness under here I mean, you
Oh,
see
yeah.
Adam's now, but you see this sculpting.
Oh, it's like it's this angle and
Here
it's
and
so
up in
tight.
here,
Oh yeah,
And even up in here, so much, it's just,
yeah.
I'm so happy. I'm so
It
happy.
is.
So I used to work out, I work out at home, and the lights are coming down.
Mm-hmm.
And so when I worked out before, everything was just, you could see every single line and droopiness. And so today, this morning I was working out, and I was like, I don't see that. You
Yeah,
know,
no,
so
it's not
great.
there.
Yeah,
It's not there.
so it's just gonna get better.
It's amazing.
Yes.
So
Alright,
I
well,
can't recommend you guys enough.
Yes.
Do a pan.
All right, I'm gonna do a little pan. Alrighty, so we got you here. I'm gonna go all the way around.
Still healing, but he looks great.
Oh
And
yes.
if anybody ever wants to like ask me anything, you know, just somehow you can contact me and I'll be happy to talk.
Contact us
Dude,
and
I'm
we'll
short.
connect you to
There
him.
you go, yeah.
I know.
I do that very well
So
because of my
let me
height.
do a quick pan.
Yeah,
No,
there.
give me light though. Give me light.
Yes. Okay.
There, just
Yeah,
hold it.
I'm way better at this.
Someone said if you eat right and drink water and don't smoke and get lots of sleep, you'll look like you. I said I don't think so.
Well,
And he's swollen
I
right
had
now,
some
you
help.
guys. He's 66 years old. Someone's saying you look under 40. You look amazing.
well, thank you. I would take 50, I would be happy with anything, but yeah.
Someone said he's not 66. No, Cosmoline, you guys, is out. Sorry. Love you all. Bye.
Bye.
All right, how do I?
Is the heat on in here?
I think I.
That's gonna be everything there.
No, it is. Oh, that's so hot.